Welcome to Chow Buddies channel, where we keep you in the loop on all things Chow Chow. For today episode is about canine influenza for Chow Chow dogs and other dogs. We will cover how you can spot it, what are its symptoms, how contagious it is, how long your dog will be sick, and what you can do to help your dog fight off this sickness. So let's get right into it. I'm the host of this channel, and I'm not a veterinarian. This video is not intended to substitute a vet's advice, but rather to provide you with some basic information. If you think your dog may have canine influenza, please contact your vet right away. Canine influenza is an extremely contagious respiratory disease caused by the canine influenza virus, or CIV. It is commonly known as dog flu. There are 4 types of flu viruses that can affect dogs. CIV was first recognized in the US in 2004. Since then, there have been multiple outbreaks across the country in recent years. Cases of CIV have increased because of the increasing number of dogs that are being boarded, groomed or shown in dog shows and other events where dogs are in close contact with each other. Unfortunately, CIV is very contagious and can spread quickly from dog to dog through direct contact with infected respiratory secretions, or indirectly by coming into contact with surfaces or objects like food and water bowls that have been contaminated by an infected dog's saliva. Dogs can also become infected if they inhale aerosolized particles containing the virus, which can stay suspended in the air for hours. Dogs can shed the virus for up to 7 days. So even if they don't show any symptoms, they can still infect other dogs. The virus can survive in the environment for up to 48 hours. The incubation period for CIV is 1 to 3 days after exposure to the virus. During this time, the virus is multiplying in the dog's respiratory tract and the dog is shedding the virus. Once the dog starts showing symptoms, the infection lasts between 10 to 21 days. Some dogs never recover completely, and some may even die. Symptoms include cough, fever, lethargy, nasal discharge, decreased appetite, eye and ear discharge, and difficulty breathing. Some dogs may even develop pneumonia. A lot of these symptoms overlap with those of other illnesses like Bordetella, canine parainfluenza, and canine distemper. So it is important to take your dog to the vet to get diagnosed. The vet will listen to your dog's lungs, check their overall condition, and run tests to confirm the diagnosis. They will ask you questions about your dog's history, including when they started showing symptoms, if they had been exposed to other sick dogs recently, and if they have been vaccinated against the flu. There is no need to panic if your dog develops these symptoms, because most dogs recover fully with supportive care. But it's still important to take them to the vet to get treatment and prevent complications. Your vet will prescribe medications such as antibiotics to treat secondary bacterial infections, anti-inflammatories to reduce inflammation and pain, and cough suppressants to soothe your dog's cough. There is a vaccine available for 2 of the 4 strains of the virus, but it is not very effective at preventing infection. However, it can lessen the severity of symptoms and prevent pneumonia, because the vaccine is made from the same virus strain used in the human seasonal flu vaccine. There is no risk to your dog's health. If you decide to vaccinate your dog against the flu, they will need 2 doses given at least 2 weeks apart to develop immunity. Booster shots are needed annually because immunity from the vaccine decreases over time. Now that we know how contagious it is, how long your dog will be sick, and what you can do to help your dog fight off the flu, let's talk about how to spot the flu in your dog. Since CIV is a respiratory illness, the most common sign of CIV infection is a persistent cough. The cough may sound dry at first, but it soon becomes productive, meaning that it produces mucus. The mucus may be clear, white, or even tinged with blood. The dog's nose will also be cold and wet because of the increased mucus production. Other signs of the flu include a high temperature, lack of energy, and a decreased appetite. You may notice that your dog is not as active as usual, or that they are sleeping more than normal. If you feel your dog's gums, they should be warm and moist. If they are cold and dry, then your dog could be dehydrated. If this happens, you should call your vet right away, because dehydration can be dangerous for dogs. Infected dogs usually begin shedding the virus before they start showing symptoms. And even if they are not showing any symptoms, they can still infect other dogs. The dog's immune system fights off the virus, so it is important not to give them aspirin or acetaminophen to reduce their fever. These medications are toxic to dogs and can cause serious side effects, including liver damage and death. In severe cases of flu, the dog's airways become inflamed and swollen, making it difficult for them to breathe. If this happens, you may notice that your dog is making an unusual noise when they breathe. This is called stridor. Stridor is a high-pitched sound that you can hear when the dog inhales. If your dog has stridor, it means that they are in distress and need urgent medical attention. Please contact your vet immediately. Coughing is the main clinical sign of CIV, but there are several other diseases that can cause coughing in dogs. Kennel cough is a common respiratory infection in dogs that is caused by bacteria or viruses. It is highly contagious and can spread easily from dog to dog. Like CIV, dogs can shed the bacteria or viruses that cause kennel cough for up to 3 weeks, even if they do not show any symptoms. This makes it difficult to know when the dog is no longer contagious. Kennel cough is usually mild, and most dogs recover without any treatment. However, some dogs may develop pneumonia and need antibiotics. There are vaccines available for the bacteria that cause kennel cough. The vaccines are given as a series of injections, usually 2 to 3 doses given several weeks apart. The vaccine is very safe, but it does not always prevent kennel cough. Canine distemper is a viral infection that affects the respiratory system, gastrointestinal system, and nervous system. It is highly contagious and can be fatal. The virus is shed in the respiratory secretions and can remain in the environment for up to 6 months. The incubation period is 1 to 2 weeks. The first signs of distemper are usually fever, lethargy, and loss of appetite. As the disease progresses, the dog will develop a cough, runny nose and eyes, vomiting and diarrhea. Some dogs may also have seizures or other neurological signs. There is no cure for distemper, but supportive care can help the dog fight off the infection. Vaccines are available and are very effective at preventing distemper. The vaccine is given as a series of injections during puppyhood, and a booster shot is needed every 1 to 3 years after that. Canine heartworm disease is caused by a parasite called Dirofilaria metis. The parasite lives in the heart and lungs and can cause serious damage to the heart and blood vessels. Heartworm disease is spread by mosquitoes that have ingested larvae of the parasite. When a mosquito bites a dog, it injects the larvae into the dog's bloodstream. The larvae then travel to the heart and lungs and grow into adult worms. Adult worms can live in the heart and lungs for up to 7 years. The most common sign of heartworm disease is a persistent cough. Other signs include difficulty breathing, especially after exercise, weight loss, and lethargy. There is no cure for heartworm disease, but there are treatments that can kill the adult worms. These treatments must be done carefully under the supervision of a veterinarian. Like the other illnesses, there is no cross-protection between the different diseases. So your dog can get sick from one of them and not be protected against the others. Also, a dog can have more than one of these illnesses at the same time. For example, a dog can have both kennel cough and canine distemper. That is why it is important for dogs to receive core vaccines and to be on a monthly heartworm preventative. If you're worried that your dog may have been exposed to any of these illnesses, please contact your vet. Your vet can perform tests to determine if your dog is sick and advise you on the best course of action. Thank you for watching. I hope you found this video helpful. Please like and subscribe to our channel. If you have any questions or comments, please leave them below. I will see you next time.